Right after the upcoming of the virus, some vaccines entered the market. Are there any other medications who entered the market similar fast like the vaccines? When I remember, there was, I think it was 2020, the first vaccines came out. This was directly after the virus came up. So normally, I thought that to bring out a vaccine takes longer. Was there anything that came out that early, any treatment, any medication?
There was. Operation Warp Speed in the United States promoted research of not only vaccines but therapeutics. So before the vaccines, bamlanivimab came out, which was an intravenous monoclonal antibody. It was safe and effective, and I used it in my practice. Later on, a whole variety of monoclonal antibodies came out, but they were ahead of the vaccines. But the vaccines, you're right, came out in record time. U.S. regulations say it takes 2 years to study the safety of a vaccine. These came out after 2 months of a clinical trial period and 1 month of an observation. And shortcutting the time to observe for safety problems is a huge mistake.
And I remember there were many voices initially warned against the vaccinations. What do we know now after 3 years? Would you promote or reject the vaccinations with the knowledge that you have today?
I was the only public figure in the world who published a major opinion editorial piece in a major journal, and I published it in The Hill, which is a widely read U.S. journal, read by congressmen, senators, the White House, people at the White House. And the title of my op-ed in August of 2020, before the vaccine trials were published, was The Great Gamble of the COVID-19 Vaccine Program. I said it was a gamble because we're throwing all of our resources towards a single approach, that was mass vaccination. We've never had a vaccination in the arm that ever really impacted respiratory illnesses very well. And on top of that, the vaccines were genetic. They were largely genetic. They were genetic code. People have never received genetic injections ever in the history of mankind, that this was going to be done for the first time. And to make matters worse, the genetic code was for the lethal part of the virus, the spike protein. So the question is, if we install the genetic code, how long is it going to be producing spike protein? What about the content? How do we shut off the genetic code? None of those questions had answers.